In case you haven't heard, America's medical industry is pretty effed, but it doesn't have to be. Welcome to Right to the Root. I'm your host, Stephanie Wright, and I've built my career on helping practices reach their full potential. Join us as we dig down to the root of the insurance industry's most complex problems and how we might be able to turn it all around. We are in Holland, Michigan, and I am here with TEDx speaker, Dr. Kurt Lindberg, who is born and raised here in Michigan and a vocal advocate for accessible healthcare. And so I'll let him introduce a bit more about himself and what he does and his passion.
Sure. So I am a family medicine physician and started practice here in Holland in 1999. And somewhere along the route, I was getting frustrated with trying to take care of patients and realizing that there was such a barrier to having the inexpensive prevention that they needed, and yet they had full access to the expensive rescue care through the emergency room.
Yeah.
And the trying to navigate themselves, there was such an expectation back when I started of these patients somehow knowing how to take their medicines, how to get prescriptions covered, how to navigate the various specialist referrals, how to make sure those notes get back to their primary care doctor. And the onus was always on the patient.
Yeah.
And what I keep telling my medical students is that we as physicians were always the people that had good grades and turned in on our assignments and got A's. And we're dealing with people who that was not true of. They were not the responsible people. They often are not self-care, doing well with that. They don't understand how medicine works. And we're expecting so much from them.
Yeah, we are.
And the result was very expensive care in the hospital when we could have prevented all of that in my office for much less. And I got frustrated with that. And so I have, in addition now to being a family doctor, I'm also in medical leadership in this area.
It's fantastic. And you're absolutely right. I learned a bit more on healthcare as a whole, starting out early. And I knew that there was something wrong with healthcare because my biological dad and stepmom ran an adult foster care home. And these were two individuals that should not have ran an adult foster care home. And so from early on, that was always, very perplexing to me. And then moving through life and having some of those different experiences myself, not understanding at all how the health system worked, or the importance of that annual visit that you need to go on. And, then I ended up working in a field in ancillary care that went to mobile dentistry and audiology to nursing homes. And PACE, I don't know if you've ever heard of that. I can't remember the acronyms. I'll figure that one out. But there's one in Grand Rapids and there was one in Muskegon, and they based it all on prevention. Mm-hmm. And I asked them at that point, too, there was an adult daycare for some people that need a little bit more needs, or just community and social life, which is very important to healthcare as well, too. And that was exactly it. They were prioritizing the preventative aspect of it. And they said, it's been proven time and time again, if you focus on this, there's a lot less that has to happen on the emergency care and palliative. And so that's what sparked my interest significantly. And then working in healthcare and understanding why is the insurance dictating the care as well.
Right.
And that was this, learning about auto adjudication and downgrades and why are we not getting paid for the services that we do? And so moving then into dentistry, I was a dental assistant clinically and moved into the administrative side of things. And again, too, here it is, the dental insurance is different, and things just don't get covered as they should be. And so diving so far deep into that and understanding, because I never even had much of information even about universal health, right? Besides the happiest countries in the world have it.
Yeah.
And I don't think that there's ever going to be a perfect system at
There's
all.
not. And I think that's where we get stuck.
Yes, absolutely.
Is I've heard it said, don't let the 10% that could go wrong get in the way of the 90% that would go right.
Absolutely.
And you're right that and this is part of why I stepped into doing a TED Talk where, my usual practice is working with individuals. And in medical leadership, I'm working with the community of physicians and providers in hospitals and healthcare insurance and things like that. But I feel like the public needs to understand what's really happening, because I think we're going to have to go back to the drawing board, and
Absolutely.
as a community decide on how to change the system, because we as physicians can't change the system ourselves.
No, and you're spot on. And that's what I've learned even with being a practice management consultant. And I've helped countless practices remove participation with the dental insurance because unlike medical, there's oftentimes still benefits available to an out-of-network provider. However, then we can provide this level of transparency of care to our patients. Delta Dental specifically is one that I've done so well with having my clients educate their patients and been a vocal advocate for more transparency on their end and accountability on their end, that in 2023, they served me a cease and desist, trying to silence me. Mm-hmm. And the reality is they went over 10 years without increasing reimbursements to doctors, and doctors are providing, again, all of this care, and they're writing off a third to half of what it is that they provide. And patients all think that every doctor has a yacht on Lake Michigan and a Corvette that they're driving in the back. But they also don't realize that since 2010, their educational debt has increased. I believe it was 90%. And, there's just so many different aspects of what's wrong out there. And there's so much profits in insurance that shouldn't be. Why don't we divert all of the premiums and everything to universal health?
So, you've named your podcast Right to the Root, and I think I resonated with that, because that's why I became a primary care doctor, and that's why I stepped into medical leadership. I keep trying to swim upstream. Where is the problem?
Yeah.
If you've heard that 5 whys, like my car won't start. Well, why? Because the battery is dead. Well, why? Because it's not charging. Well, why? Because the alternator is broken. So you kind of, as a primary care doctor, but then also trying to fix the system, need to kind of keep going back to why. Mm-hmm. There's the big controversy right now with United Healthcare denying care. Why? Why are they doing that? Well, they're trying to keep premiums low. Yeah. Well, why are they trying to keep premiums low? Because the employers are going nuts trying to lower their cost of healthcare, because they're the ones that are paying the burden of it. So you go to Delta Dental, who's paying those bills?
Exactly.
Right? It's large corporations. They're screaming at Delta Dental, you got to keep those rates low. Well, if they're going to keep the rates low, they're going to have to somehow reduce cost. The problem is, I don't think, and this is part of, again, why I'm trying to get out in front of public and help people understand, the way you reduce costs is not just pay less for the same things. You prevent them from needing to be done in the first place. So I told a story in that TED Talk about a patient of mine that we could have saved his life with hundreds of dollars, and yet he spent millions in the ICU. And that's just a bad way to do things.
Yeah. It absolutely is. Yeah. And that's where, taking it back to the PACE organization, and they're dealing with either adults with some higher special needs, but primarily it was geriatric care, right? And that is very expensive, geriatric care at that, or anybody that has, underlying health conditions, or as you were speaking about your one patient, how much he smoked.
Yeah.
There were a time, even in my life with my kids and as a single mother, that I made just a little bit too much to have them on public health and had to pay for it. I couldn't even pay for myself to be on it. But there was at one point, too, with their medications that they had to be on. And one of my sons has ADHD and he had depression. I forewent taking my own blood pressure medicine so that I could afford his. And that's the reality of what it is today. And, so then I also prevented myself from going to any doctor to prevent any emergency, to do any of these things, because I had to afford it if my kids needed it as well.
So there are a lot of reasons the U.S. spends more on healthcare. So we could go into a large, deep dive on why is the U.S. different than other countries. But I think the point I'm trying to promote is we need to lower the barriers on prevention.
I 100% agree.
So we have these high deductible plans. Well, I understand why they exist. But like you, people don't want to have to or can't pay the money to come in and get the services they need, or to take care of something in the infancy. So we need to continue to think about that. The trouble is we've set this fee-for-service system up that is designed with the idea, again, of it will lower cost to have competitive providers, but to prevent disease from happening in the first place is the cheapest thing you can do.
It is.
But it doesn't make money. So you can't build a healthcare system on nothing happening. I heard an example recently of someone saying, for a hospital system that makes money on taking care of parachute accidents, why on earth would they be helping people get better parachutes?
Yeah.
There's no common sense to that. And that's the system we've set up. Yeah.
It is. I don't know if you've had this on your end, but the amount of, I always insert myself in situations. If I hear somebody talking about their insurance, I've even done it on a plane because it was October, it was open enrollment, and they're looking at the different plans. And I was like, excuse me.
Yeah. I know a little something about this.
Let's go ahead and talk this out because everybody's really, they're afraid of the premiums, right?
Yeah.
And then we can lower the premium and then we can have a higher deductible. Right. And one of the things that I have found just very startling is the amount of general public that doesn't realize that the baseline prevention, just that first exam and what they have to do annually is covered. And,
right.
And they don't know that either.
Right.
So they still
right.
don't go to the doctor.
Or mammograms.
Yep.
Or colon cancer prevention.
Yeah.
Yes.
How we can get ourselves out there and insert in so many different situations to educate anybody that's coming up of you can.
Right.
However, what more steps can we do to make that better, right? If somebody's starting to feel like they're sick in some sort of regard. I remember I felt awful for a very long period of time before I finally went in. I mean, I had almost passed out and still they don't know where I had an infection, whether it was a bladder infection or whatever it might be. But I waited until the very, very last minute.
And then you end up in the ER.
Yeah, exactly.
Which is the most expensive place to get care.
It really is. But I was so afraid of paying $250 or whatever it might be.
Right.
And that's part of prevention as well, too.
Right.
If you're starting to realize something, why on earth there is a constant co-payment for everything that we have.
Right. I don't think there's universal awareness of the value of preventive care.
I agree. Yeah.
And, even in the people who make decisions at the national level, I think they might have a little bit of an idea, but I don't think they fully understand. And there's I referenced in my TED talk that we're starting to work with venture capitalists who do understand the equation and want to make money on it.
Which is very interesting to hear.
It makes me feel kind of creepy, to be honest, being, kind of a dyed-in-the-wool, well, exactly.
Yeah.
I'm not into making money. That's not why I went into medicine, and certainly not
I don't think most
medicine,
doctors went into medicine to make money.
Yeah, I hope not.
Yeah. There's a few out there, I'm certain of this, sure.
But certainly, I think most people in primary care have a passion to help people. That's their primary goal.
I would agree.
But at some level, you need a sustainable business model. Right. Mm-hmm. And that's kind of where I've had to kind of wrestle internally with this. But what they're doing, these venture capitalists, is they're coming in to an insurance company and they say, we'll take the risk here. And we have deep pockets, right? So that's the thing about venture capital. They've got hundreds of millions of dollars to start with. And they're putting that money into prevention. And they're finding that they can, 8 to 10 times gain profit by people never getting sick.
Yeah.
And so if we can prove that model works and get enough momentum behind it, then I think we might be able to make the change.
So how do you feel like that would work? What would be your first, if you had this magic wand to prove that it works and to share? Yeah,
there's a lot of literature out there, but I don't know how many politicians and big business decision makers are reading medical articles. But the more a patient sees a primary care provider, the less money gets spent on them. Yeah. End of statement. And this venture capital group is Agilon Health that we're working with. They come to us with statistics of this. They'll show us graphs of how many visits a high-risk person had in a year with their primary care doctor, and all of their costs go down the more visits they have.
Yeah.
They can't explain what's happening. So they're like, well, what did they do at the visit? We're like, we don't know. Maybe they're just encouraging them to think about their health more or take their medicines or eat healthy. We don't exactly know. Or maybe they picked up a finding on exam that they would have, to your point, ignored until it became a bigger deal. But that seems to be a constant across primary care studies across the world. But it doesn't make a lot of money in America because you need a big procedure. You need a brain surgery, an MRI scanner to make money. And prevention doesn't make money. We've got to figure that out.
It's even within my own experience and the prevention doesn't make money aspect of it is whole family lineage of breast cancer, right? Yeah. So from Ashkenazi Jewish women from age of 30 getting my mammograms. baffling to me every appointment that I have to sign off that I will pay the difference for the 3D mammogram.
Right.
Nonetheless, I'm still there. I'm still getting it. But there are women that cannot afford that additional amount, period. And so in 2021, in the early February, I had a mass that they found on my right side. They did a biopsy. It was benign, but it had pre-cancer indicators, what they told me, and that they were going to put a clip in there and they were just going to monitor it and see size. And I said, prophylactic breast removal. Why would we wait for something and watch it? And it was refused. And so I pushed back on the insurance significantly, and I was able to get MRIs and a rotation and a tighter rotation of my screenings that I had. And so less than 18 months later, I had two different tumors on the opposite side, very far into my breast tissue and my armpit. And the oncologist at that point said, how did you push for this? How did you get this done? Because you would have probably had cancer 2-3 years before it was caught on mammogram. Right. And so, going through that process, and immediately I sat right down with the surgeon when it was, having this consultation to identify what different routes of care I could go through. I caught it so early, but they pushed very hard on having radiation. No. Yeah. Why would I have radiation over here when I have another spot over here? Right. And I knew having that pushed for it is because most doctors lose their autonomy of care depending on, what area of health they're in, because there's no money in going in and just preventing everything on the other side. There's a lot of money from the insurance company they can get from radiation. And that was really hard for me to sit down and keep pushing. So I don't care if you feel like I'm the perfect candidate for this. I don't agree with it at all, especially when there's on the other side. And so I did. I had my bilateral mastectomy, and still, having that really sparked a fire inside of me that, we have to have more support with collaboration of care as well too, because that's another reason why people don't want to go to the doctor. Right. They're not being heard either. And, to me, if I had no family history, whatever it might be, and nor educated on the thing, I probably would have just taken the radiation. Right. And so having to push as hard as I did to have, the results that I wanted for that care, it was hard. And I really genuinely, I think even then when I had the imaging and the biopsy, and I would have still went on an annual basis, right? But I pushed back. Nobody else does this. Right. Oftentimes doctors don't even push back on insurance as well too, because they don't know. You guys don't learn any of this stuff in school, and you have to take care of patients. And
you have to be able to prove that it's worthwhile too. And sometimes that evidence doesn't exist or isn't convincing. Yeah.
Or what is the administrative burden to try to push back on it as well too? Right. It's because doctors are having to see more and more patients throughout the day, and that's really hard to have that balance. Right.
Yeah, and to your point, why is the U.S. spend more money than other countries? One of the reasons is we have more administrative burden because we have all these insurance companies we have to deal with, and they say, and again, why is that? Well, they have more restrictions on what we can do. Well, why is it? They're trying to keep premiums low, right? So I understand the big picture of it. We just have to kind of figure out a better system. So, if you give a healthcare community like ours, let's say, I gave an example in the talk of say you get $1 million, take care of them well, and then you have to have some accountability for that, right? Because you can't just neglect people. But then you can keep the change. Yeah. All of a sudden you're having different conversations, right? What's the best way? Is back surgery the best way to improve someone's back pain? Yeah. Well, if you talk to a surgeon, that's the bread and butter. Of course it is, right? Yeah. But maybe that person doesn't need a surgery. Maybe that they need something else that's much less expensive. So it drives different conversations as a big collaborative group, which those are the conversations we have kind of daily.
So do you think that in the medical community, specifically with doctors and specialists, what part of the medical community, such as family medicine, that really is an advocate, really understands and wants that universal health system to make sure that we have complete accessibility to prevention? Yeah,
I think the average primary care doctor is just on the treadmill and is just trying to keep up with the increased demands. And so all of my primary care fellow providers, I think, just feel overwhelmed. And they don't feel like they have power to change. And so being in medical leadership, I do understand more and I have more ability to make some changes. But this is going to have to be a big decision of how do you pay for healthcare. So I get into the administrative of like Blue Cross Blue Shield of Michigan and whatnot, and I'm trying to convince them, I think it would be to your best interest to have zero copays for patients to see their primary care doctor. And so they would have zero financial barrier to come in if they noticed a lump or if they have a little bit of a cough. And so we talked about there's this movements now, they call it direct primary care. You could say subscription model, I think is an easy way to think of it. Where the primary care doctor is getting a monthly fee. Again, keep the change, but take good care of these people. And that I think would help drive more people into primary care, because I think we would be off the treadmill a little bit.
I absolutely understand. And we're always going to have some of those patients that we have to see them a lot. I also find some of those higher, need patients that maybe they're a little bit more maintenance to it as well. If it was accessible consistently for them, instead of having it all this boiling point and then when they come in and it's just like, and this and this and this and this and this, right? Again, I think.
But these people go to the ER. Now you go talk to an ER physician and you say, who are your frequent flyer list? And quite honestly, they aren't all the times very sick. They're just very worried or very lonely. And the ER's free to them.
Oh, absolutely.
So they walk in and, hi, I'm having a cough today, or my ear hurts. And,
it is.
I'm stressed.
Working in healthcare myself, I'm actually sometimes an awful mom because I, not only being a single mom for so long, it was like, if I have to take you to the doctor somewhere during the day, that's hurting my, it really was. And my one son he broke his hand and I was like, you're fine. You're fine.
Right. I rubbed some dirt on it.
Yes. And finally had to bring him into OAM urgent care. And I was like, okay, I'm awful. But even then, my children, as far as, unless you have a fever that we can't control under Tylenol, you're staying, home and we're going to be fine. I
was looking at this last week, again, trying to decipher a little bit of why are we as a country different than other countries. And the average country that spends, what is it, half as much money as we do, but gets better quality results, has 3 times as many primary care providers to the population as we do. So again, it's hard to convince someone coming out of medical school. You made the point of medical debt. They can't take a low-paying job. They've got to go find one that's going to help pay their bills. And if they're going to be running on a treadmill that they can't control, and they go do the rotation with the family doc down the street who's like, oh my gosh, this job is awful. I hate it. And I'm like, well, I'm not going into that.
Right.
So there's I think we've neglected as a country, because we've been so overwhelmed with all of the outcomes that we haven't been preventing. We've just been putting out fires nonstop. We haven't thought to try and prevent them in the first place.
It is, it's absolutely, and as we talk about, and why is this, and why is this, and why is this, and so bringing up that educational aspect of it, and knowing that, I have clients that, when they come out of dental school, they have 2 choices, and it's either they are lucky enough to find a doctor, private practice with an associate need, at that, and hopefully they have somebody that's helping out with their student debt, who knows if it's parent or a scholarship, whatever it might be, because like you said, private practice, they're not going to get as much money. But if they go to Aspen, they're going to get their health insurance, they're going to get these, and they're going to have this high amount, but it's almost like a factory, right? Kind of like pushing some of the doctors through, and, knowing and looking at the statistics for the student debt for doctors coming out, and we look at a dentist between $300,000 and $500,000 is what they come out of debt for. And when I was in Iceland and asking the doctors, the dentists there, similar educational system as far as how long they have to go for, $250 a year is what it cost them. And so much so, the orthodontist there, he came to America to become an orthodontist, and Iceland paid for it as well. He had no idea how much the education costs when he went there. And so when I told him about how much doctors are coming out of debt with, they're shocked. Both doctors are just like, why? Why? And so there's so many tentacles per se that is feeding this problem that we have. And we start looking at it from, again, being on the hamster wheel. And so many doctors that I work with it's having shorter appointments, getting patients in and doing this. And, again, too, I'd love to be able to hear your feedback about Delta Dental specifically on that, because it's that one's really hard for me, advocating for accountability and transparency and for my clients. And not a single one of my clients are overly greedy, right? are there some doctors out there that are? Absolutely.
Yeah, I am not an expert on dental. And, we were having a little bit of a chat before we turned on the cameras about how the tradition in the U.S. is that dentistry goes to dental school and dental training, and then
Yes.
you have dental insurance, and then medical school and residency and medical insurance, and there's a big divide.
Yeah.
So I'm sometimes embarrassed at how little I know about dental care.
Well-
when a patient comes in, I try to explain to a dentist, well, it's the tooth that's right next to the sharp, pointy one. And so I have very little
That's
dental
all right,
knowledge.
though. I
Yeah,
mean-
but it's some of the same ideas of, the insurance company and who's paying for the insurance and care that's needed. And I have a story of a friend who has a son with a cleft lip and palate that, this is a medical condition, and yet they need special dental care, but it's not under it's not under medical insurance.
It's a battle.
Yeah.
Yeah,
Right, so
going back and forth.
right,
But then,
right.
This whole opportunity of where they probably have to submit it to dentistry or dental insurance to have it denied, to go over to medical.
Yeah.
Most dental practices don't know even how or what to do with medical insurance.
Right.
I mean, I only know just the smallest bit. So again, I'm learning more on the healthcare side of things, but knowing as much as I do about dental. But it's difficult. And the normal person does not know how to navigate this system, nor do they have the support.
Right.
Because if they contact the insurance company, they get a different answer each time.
Right. Well, and their primary interest is their own premium and how much money they pay out,
Yeah,
right?
yeah.
So that's not the right person to give you guidance.
It really, and that's exactly it too, And
Yeah.
so, but then now it adds into this like vicious circle
Yeah.
chasing our tail, because then they go and they look to the doctor that also says, I don't know.
Right. Right. Call your insurance company.
Exactly.
Yeah.
Right. Because the other part that happens is if we try to make a guesstimate on it, if we try to say, I believe this is the route that has to go and it's wrong, guess who's to blame?
Right.
The doctor. The patients think that the doctors or anybody working there knows exactly 100% of everything. Well, I have priority health. That's great to know.
Yeah.
There's thousands of different plans that could be available.
Right.
And not knowing that portion of it. And so, the dental aspect of it and the insurance and the divide on there, there's a benefit to doctors and dentistry because they oftentimes have dental benefits available to them outside of network. But that is a very for-profit machine in dental insurance. I think it's, again, was so much more alarming when they served me, this little person from West Michigan, a cease and desist to stop talking out against them.
Right.
And doctors they're not able to talk out against the insurance company, right? Like that's a big no-no, even though I don't think anybody would ever go to jail for it, right? Like,
yeah. One of the things talking about insurances and profits, one of the things I think is not understood by the average person, and certainly not the average media broadcaster who is making this sensational. The Affordable Care Act, one of the hidden secrets of the Affordable Care Act is it prevents insurance companies from making a significant profit.
Yeah.
So they are limited, I think, to 15% of the money that comes in their doors has to be spent on whatever it is that they do. So paying their own staff, paying to man the phones, paying for their administrative and the billing and all of that, and whatever's left over they can keep. So they can't make it 20% or 30% and pocket more and more change. That's one of the things that Affordable Care Act did, was prevent them from. So when I talk to insurance companies, they're struggling to keep their premiums low on behalf of their customers, which is like Ford Motor Company or Gentex or something like that.
So how come some of those, again, too, when we look at the executives at some of these insurance companies, right? Like, and I hate to tie it back around to Delta Dental, right? It's a for-profit insurance, or no, nonprofit insurance company. And it's to say, well, we could keep premiums low if you weren't paying somebody $17 million annually. How?
Right.
Like it's mind-boggling to me. Well, then divert those funds there, people, because now you won't have such an upset community.
Yeah.
Who needs $10 million a year?
Yeah, and you mentioned this early in our talk here is there's no perfect system.
No.
Right. So if you're going to have a for-profit, competitive healthcare system, and everyone's mad at big pharma for making so much money and hiking up the cost, well, that's what we've told them they should do, right? We thought this is a great idea. If we want governmental healthcare, well, then everyone will be making, a very small amount of salary. but then we're going to take whatever headache comes on the flip side of that.
Right,
So,
right.
so we have to pick our poison at some
We
point.
really do.
Yeah.
But I mean, again, too, it's to say, and this is why I want to travel the world, or I am traveling the world, because there is something significant about the happiest places on earth having universal health. And even the doctors that I talk to, they're very happy. They're very satisfied. They're not coming out with hundreds of thousands of dollars of debt.
Right.
There's more freedom and autonomy in their care as well, too. Iceland, I take it back to their Dr. Brina, who I interviewed. I had talked about denials, and and she's like, I mean, I can remember one, and she explained a very elaborate case that I was like, I've never even had a patient.
We have an entire staff at my office dedicated to authorizations. So that's probably about 2 full-time equivalents in our office of trying to get through the maze. We're talking about administrative costs.
It's a nightmare.
What a great episode with Dr. Kurt Lindberg as we discuss the loss of one of his patients that absolutely could have been avoided because of this cookie cutter style healthcare system that we have. Speaking cookie cutter, that's what we're going to get into in episode 2. So I can't wait to be able to talk about some really controversial topics and why we're all treated just the same from one doctor to the next.